This tool not only helps you look at research, but it makes you put it in a logical framework.
Better quality research results in better quality projects.
It provides us with a much better and organized process to get to the outcome that we want. Our students need to become critical thinkers and decision makers, as well as learning all the theory and experience and skills that they need to develop. If we don't include the stress on evidence-based practice in their studies, we're really missing an opportunity to prepare them to be better practitioners. When I saw the tools from the Collaborating Center, I thought this is what I need to enhance this course.
The course was a fourth year, what they would call a capstone course, meaning bringing lots of elements from stuff that we learned in previous years together. It was working in the community with a certain population of people, and within a short time of 6 to 8 weeks, developing a project to respond to a need of the community, and then taking that and bringing it to the community and implementing it within the community.
I started by doing the online modules. I needed to strengthen my understanding before I taught anybody else. So I did the modules. I found them very helpful, and I found it easy then to pass that on to my students and the other faculty.
The tool was introduced to us in the classroom by our instructor, and at first, of course, it's a bit confusing, and you're wondering, you know, oh my gosh, there's a million different parts to this, and there's a million different papers to read. But once you get familiar with the process, then it's a natural process, and it makes a lot of sense.
In order to keep patients and clients safe and to have the best possible health outcomes, you need to work on all kinds of evidence. It helped them build their skills in searching the incredible amount of literature that's out there. It helped them focus really early, and they got organized.
Using the tools that the website had offered, we were definitely able to come up with a more concrete idea of what we needed to have, how to do it. And that's a big thing, is how to do it, because it's very easy to get off track.
We learned to use the PICO question to focus our research. We used the wheel to help us gather and to sift through the research and to apply it and to evaluate. And we also use the pyramid to help us identify which research was of better quality.
Because the tool walks you through the process, you can see the answers that you're supposed to get to quicker, and each step has the exact information on how to get to each step, which is really helpful.
It is easy to follow. Read from the very beginning, don't skip ahead. If you do that, your project will be so much easier.
They followed through, and they all did an amazing project at the end of it.
Things like this are very important because it brings that research into the practice area. There has to be that bridge between the research and practice, the theory and practice. You know, we need to be able to do this in a practical way. So these models really help us to do that.
As students going into the professional world, we're at an advantage because we have learned this model. It really gives you guidance, and it gives you the structure that you need, and now everyone can be on the same page.
Using evidence-based information, it's going to save you a lot of money, a lot of time, and it's already a compilation of a lot of knowledge.
It was our last opportunity to help instill that in these students. The importance of evidence, whether you're in the acute care or whether you're in a community health setting, that it's critical to good practice. So for me, I couldn't not teach it, and the model was one way to do that and bring it into a public health perspective. I think it can be a very useful tool as one way of becoming more intentional on the use of evidence, as well as listening to communities and not forgetting who we're working with. I think if we're going to talk about sustainability and in good health outcomes, we need to have a good evidence-based practice.